Welcome back to Real Health. Thanks so much for joining us. Well, cranial sacral therapy is often used for infants who underwent a difficult delivery, which resulted in birth injuries. But it's also effective for an array of other common problems that babies may be experiencing, including nursing and feeding problems, colic, teething issues, and so much more. So to shed some light on this topic, we've invited cranial sacral therapist Justine Hunt back into studio. Love having her with us. Refresh our memories. For those of us that are tuning into Real Health for the first time, what is cranial sacral therapy?
So generally we work with the whole membrane system from the tailbone and the coccyx all the way up the spine and around the brain.
Okay.
So that layer of membrane has there's three layers of membrane, and the outermost layer has the vertebra on the outside of it and the cranial plates on the outside of
Okay.
it. And we can feel the cerebrospinal fluid flowing in and around the brain and around the spinal cord, up and down the spinal cord. And we can feel restrictions in the cranial plates, resulting in restrictions and twists in the membrane system as well.
Okay, so
Yes.
this is powerful for a newborn baby because, you know, many people think there aren't a lot of therapies out there for newborn babies. They're such tiny creatures.
And so delicate and
and so
fragile.
delicate,
Yes.
yeah. So tell us why it's quite effective for newborn babies.
So with the newborn baby, there's all the cranial plates in the adult are fused with interdigitated sutures. With a newborn, there's little bones floating with a cartilage around them, floating on the membrane system. None of them have fused yet. They're in different pieces. Some of, like the frontal bone, is actually still in two pieces. The occiput, which is the bone at the back of the head, is actually in four pieces and only fused with a little bit of cartilage. So nothing is solid yet, which is how nature intended to enable the cranial bones to compress in order to come out the birth canal.
Yes,
So it's actually an
yes.
amazing way nature's designed it. But then you're supposed to have remolding, a certain amount of your own body's healing and ability to remold into a better position.
Okay.
But when the forces during the birth have been excessive or compressive, or a forceps delivery, or
Yes.
rotation pattern, or a facial presentation or something different than a normal natural birth, then we're dealing with a lot of cranial compression, which affects the membrane system, which affects the whole central nervous system functioning, and it shifts the body into fight or flight, into the shock, which then we see is colic, crying incessantly, difficulty to sleep, difficulty feeding. All of those things come from that major shock in the system, but also from specific areas of the brain being compressed.
Because it's trauma.
It is trauma,
And
yeah.
for babies that it hasn't been dealt with, you know, what does that sort of lead to in adult life?
So some minor compression patterns of specific bones will actually lead to just sort of things that you notice maybe a 4 or 5 year old, their motor planning isn't so great, or they're struggling with puzzles at school, fine motor may be affected. So it might be more slight things. It might
Okay.
be ADHD, it might be slight learning disabilities. But even if they aren't noticed, as an adult,
Yeah.
you might grow into an adult that has chronic headaches and migraines, neck problems, even your pelvic problems, because depending on how the child comes out, the effect normally is around the cranium and the base of the cranium and the neck, but sometimes it can actually be a pelvic rotation pattern, which will then also affect the rest of the system.
And that leads to postural issues, and that's why as a
Exactly.
physiotherapist it's such a great complementary area of
exactly.
specialization. What is colic?
So colic, look, we define colic as a child that cries incessantly for more than 3 hours, 3 times a day. But basically the way we see it in cranial work is that it's a major shock to the nervous system. So there's that fight or flight effect. So when you've got your fight or flight, your sympathetic nervous system, which is your fight or flight activation, becomes overactivated, and that shuts down the sphincters to the digestive system. It reduces blood supply to the organs, which in itself will start causing reflux because the pyloric sphincter contracts.
Yeah.
You don't have good absorption of your food or nutrition of the milk, and they're constipated because the sphincters aren't opening. They can't move the food properly, so they bring their legs up and they're crying and they're uncomfortable. But also it can affect sleep. So any fight or flight effect will basically shift the body into shock.
That poor, fragile baby that we're talking about, so stressed out and limited communication.
Exactly.
So this is where crying comes in, because, you know, often crying is not just a sign for food; it's a form of communication from this baby. What else can it mean?
Well, if they wake up crying and you give them the breast and they latch, or bottle, then and they take it and they drink, then you know that that was definitely food. If it's crying, it could be stomach cramps, it could be pain, it could be neck pain, it could be headaches. So sometimes the mom will say, but you know, they're not cramping and they're regular stools, and so they're confused because they sign, most people see colic as being digestive imbalances. But if they've had a major compression to the cranium, it might be that this child's almost got a residual headache.
Oh yes.
So it's a sign of pain. You know, the child is trying to explain something. I mean, my son, I had a beautiful natural birth with him and obviously treated him afterwards.
Yeah.
And he would wake up, cry, feed, fall asleep, and sleep for 4 hours, wake up, cry and feed. And he got himself into his own cycle, and there wasn't crying in between because he was comfortable, he wasn't in pain, his digestive system was fantastic, his sleep routine, he went into his own sleep routine with, you know, his own natural process. So crying incessantly is something that the parents need to address. It is the baby's way to communicate that there's something wrong. And to just use a dummy or an aid to get them to sleep and ignore the fact that they're trying to communicate something is also not great.
Because that's just sort of a go-to, and I obviously can understand parents are deprived of sleep.
They get desperate.
I can understand that. And especially if it's their first child.
That's the thing. I think when it's your first, you don't know what to expect. You don't know what normal is. You might phone your mom, and you know, if she grew up old school thinking, she'll say, you know, just use a dummy and let's deal with it. You know, that's what it is. But for us, you know, new age, we've got so much more information now, and we can bring our children up differently. Just be aware that this child's trying to communicate with you. Also calm yourself down, because the more agitated we become, children and babies and children are like animals. They can sense anxiety, they can sense stress, they can sense anger. So you just need to kind of stay as calm as you can and seek support.
It's an energy that they pick up on.
For sure. And also they know the mom's smell. They can feel if they're against your chest and your heart's beating, or they can pick up that agitation in your nervous system. So just stay calm, seek support. Look for you know, either a midwife, myself, a homeopath. Look for support. Find support. You're not alone. There's always someone that can help you through that.
Just run me through how the therapy actually works. So mom's given birth. How soon can she start doing craniosacral therapy?
We can even treat a few hours after the birth.
Really?
Yeah.
Okay.
So I had one case where they phoned me. The parents knew me before. And they landed up having, unfortunately, a traumatic birth. They needed to it was that or an emergency Caesar, but the child's head was too far down. So they landed up using a forceps delivery, and the forceps slipped, and it rotated the temporal bone here right. It actually compressed it right backwards into the occiput at the back. Visually, you could see the asymmetry of the child's cranium and face. So they phoned me, and I said, right, let's start as soon as we can. And I actually went to the hospital and saw the baby. And
what did you do?
So it's very gentle. We hold from a little one. I mean, they're so small. We hold the tailbone under the one hand, where I can actually feel most of the lumbar and almost the thoracic spine with that hand. And then I hold the cranium and the head on this side. So we can actually feel that cerebrospinal fluid moving up and down, or we can feel the twist pattern throughout the dural membrane, throughout the spine. We can feel the twist pattern, or we can feel the excessive compression or whatever's happened. And some of it might be from birth. Some of it might actually be from the position the baby was in
the womb.
The womb.
Okay.
So if there was a fibroid, uterine fibroid, or sometimes it's a twin. That is pushing
in my space.
You know, the one twin's a lot bigger than the other, and there's very limited space for twins to move if they're big babies. True. And the one might have been in a funny position most of, for the last 2 months or whatever of the birth. Of the pregnancy, and that we need to also release. So the sooner we start, the better. The longer patterns have been imprinted into the system, the more treatment it takes for them to release out. So it's not to say, I treat adults. It's not to say that we can't treat babies and children, or even a 5-year-old or a 6-year-old.
But it makes for a better upbringing, better teenage years, and young adulthood as well.
If you're a newborn baby, or even when you get to about 4 or 5 months and you're starting to interact with your parents, if you're not in pain, your parents will be smiling at you because you're a happy, content baby, and they'll be getting that positive feedback from their environment all the time of everyone smiling at them and goo-gooing and all of that. When you're a child that's been in pain, or you've been in colic and the parents are fed up and everyone's looking at you all concerned,
completely
it's a totally
stressed
different
environment.
psychosomatic environment that you land up growing in. So it does, your physical does start to then impact on who you are in terms of your development and your psychological
It sounds to me like if you have multiple births, it's definitely worth just investing in cranial sacral therapy anyway.
For sure.
And if you have had a healthy birth and everything sort of runs smoothly, is it just something that you should do, and maybe not perhaps in the first couple of days or weeks, or when should you just consider?
I would say, look, in the ideal world,
yes,
I would actually suggest everyone brings their newborn baby within the first 6 weeks. So not in a major rush.
Okay.
Once you've settled and you've got into a home routine environment, if they're having no symptoms like my son, I treated him anyway.
Yes.
Because it can only help. So any restriction of that membrane, even if it's a slight restriction, won't affect them as a newborn baby because their brain is still small. But as soon as the brain starts to grow and they go through growth spurts at 3 and 4 years old, that's when you might notice that there's actually a limited space for the cranium and the brain to grow into. Whereas if you do it from newborn and you just do a once-off session, I've had a few people, I treat once and I say everything's great. There's always still something to treat.
Yes.
We can stretch everything out. Every birth has a level of shock and you can just release it completely and they'll be happier and healthier. And obviously if there's any symptoms or signs, to bring as soon as possible.
Is the therapy, before I let you go, steeped in any or sort of based in any ancient traditions? Because I'm sure somewhere on the planet, people must have been doing this thousands of years ago, this type of therapy.
I read, and it's interesting you say that because I read somewhere from, it was 1500s, they called them bone setters. And they said that once babies were born, they would send them to someone that would set the bones, reset the bones. So it was interesting that they called them bone setters, and they the way they described it, which is why I thought it very similar to cranial work, is they were talking about holding the head and resetting the bones. So maybe it has been, a lot of these therapies have been around in different forms for so many years.
Well, thanks so much for joining us. That was fascinating.
Pleasure.
And I'm sure, lots of good information for our viewers. Thanks, Justine.